Move now to Mr Kim Wells.
Thank you, Chair. I only have 10 minutes, so we'll do our best. Professor Sutton, is it going to be your recommendation to government that the Victorian population should receive an annual vaccination from here on in regarding COVID-19?
I can't make any future predictions around what my recommendations can be. As I've said right through this hearing, I need to look at the circumstances at the time in order to make a proportionate response to the threats. If we're in a situation where there is long-standing immunity from a booster dose, whether it's called the third dose or whether it's a fourth dose, and it's not required every year, I certainly wouldn't be making a recommendation or a mandate for it to occur every year.
Okay, thanks for that. Did Victoria Police contact you regarding the iCook Foods investigation?
Can I just raise a point of order?
Point of order.
I'm really.
Can we stop the clock, please?
Struggling. Well,
can we
you
stop
raised
the clock?
one earlier, to see how this is relevant to the orders.
Okay, let me rephrase the question.
Yeah.
During the pandemic orders that have been in place, have you been contacted by Victoria Police in regards to iCook Foods?
Point of order. This has no it's got no bearing.
Use the word pandemic orders.
Look, I think it's pretty clear what the role of this committee is, and it's to look at the pandemic orders and not to really try and pull in some red herring. We're here to talk about the pandemic orders and the section that we're tasked to look at. And
I did use the term pandemic orders. I just want to know.
There's a level
during the pandemic orders. Had he been contacted by Victoria Police?
You know that doesn't cut it.
Okay, so I'll move on.
Good.
Just following up from Emma Keely's question. So do you or do you not have the number of workers that have been stood down due to vaccine mandates?
I don't have them at hand. Can
we get them sent to the committee, please?
I can certainly inquire as to whether they're held with DJPR.
Okay, and then can we have a breakdown of by workforce? Because I think it's important for this committee to know nurses, teachers, AMBOs, for example.
I believe for the healthcare workforce, it's a tiny percent, less than half of 1%.
Yep, that's fine. But if we can get that information, that'd be great. Also, regarding the pandemic orders and the advice that you give the Premier and the Minister for Health, it's written all oral. Do you agree that when you give oral advice, that this advice is actually not freely available to the Victorian public? It's hidden or it's secret? When you give oral advice?
I might ask Ms. DeWitt's...
No. Well, I've only got 10 minutes, so we'll have to keep going. But if you give your advice is what I'm asking you. If it's written, we get to see it. If it's oral advice that you give, do we get to see that oral advice? Is it taped or written, or is there some way of doing it?
It is recorded. Ms. Brady is here. She's often the transcriber, so I might get her to respond to that.
No, that's fine. It's fine.
Well,
if I could just ask then for the recordings to be provided to the committee. Can we have the recordings provided to the committee of that oral advice?
My understanding is that the legislation requires it.
I could confirm for you that it is published online in the Pandemic Orders Register. So whenever there's been an oral advice provided as opposed to written Chief Health Officer advice, it's all there on the Pandemic Orders Register.
Sorry for not doing your homework, Mr. Wells.
Pardon? Well, no, we can ask. We'll go and double check that.
Next
That's
question.
Fine. Pardon?
Homework. Take it seriously.
So I'll move on. I just want to go back to a question that Georgie Crozier asked in regards to the tennis. Obviously, it was a shambolic mess, the Djokovic situation. Are you saying that you had no role in the setting up of the medical exemption review panel?
Correct.
And so you have no idea who is on that committee?
No.
So when you came back from leave, you weren't interested to find out worldwide news who was on the committee and who made the decision?
No.
Would Miss Brady know?
She may.
No, I don't.
So no one knows. Is that...
It
Well,
it is of no relevance to me whatsoever in my role as Chief Health Officer or in the making of pandemic orders as to how that panel is constituted.
So you offered no advice whatsoever, or your acting CHO, no advice whatsoever in regards to that medical exemption for Novak Djokovic?
Correct.
Okay. It just seems very odd that when the Premier said that on the 27th of October that Victoria would not seek exemptions for unvaccinated players, that then the Victorian government would approve a border permit for Novak Djokovic. You don't think that's odd?
That's not a question for me, Mr. Wells.
Okay. Thank you. I'll just go to some of the questions. In regards to mandates, on page 7, the acting CHO details continuing increase in hospitalisation and ICU admissions with no indication that Victoria had peaked for either metric. What is the actual number of hospitalisation ICU admissions that the department would consider a peak if we're going to have another peak over the next couple of months?
You mean an acceptable or an unacceptable peak?
Well, a working peak. What would be the plan put in place that the hospital system could cope with in regards to another outbreak?
Look, I think that's probably for the State Controller as well. This relates to the mobilisation of additional ventilators, ICU beds, ward bed capacity, workforce, etc. They are not considerations for me specifically as to how we can meet them. I would obviously receive the State Controller's advice on whether or not the trajectory of another wave or epidemic spike was going to challenge that and what we might need to do in order to stay under that number.
So would we be able to get that advice, or do we need to ask the State Controller directly?
Well, I guess you would have to ask the State Controller directly, but I'm not entirely sure what the question is. If it relates to what is the absolute limit that can be tolerated within the health system, perhaps that's answerable, but I'm not sure that would necessarily inform my advice as to where restrictions should be.
So in regards to what the hospital capacity would be if there is another outbreak over the next month, what would it be?
Yes, I would direct you to the State Controller.
Okay. Miss Brady wouldn't know that answer?
No.
I refer to modelling on the impact of Omicron following the Australia-wide Doherty Institute modelling released in December. Did Victoria do any state-specific modelling as New South Wales and South Australia conducted?
Yes, we did. We did some modelling with the Burnett Institute.
And can that be released to the committee?
Has been.
Yeah, I believe it's been released.
Thanks. On page 8, details 591 cases in hospital. This is on page 8 of the table, representing an estimated 29.9% of currently available ward beds statewide for COVID-19 patients. Does that mean there are only 1,977 wards beds statewide for COVID-19 patients?
Again, a question for the State Controller. I presume that means those that are currently mobilised, not potentially mobilised.
Regarding paragraph 27 of the Acting Health Chief Advice to the Premier, as of the 5th of January, there were 53 patients with COVID-19 intensive care units, representing estimate 12.9 of staffed private and public ICU. Does that mean there are only 411 staffed private and public ICU beds in Victoria? Is that correct?
Again, not a question for me, I'm afraid, Mr. Wells.
In regards to the tennis, I just want to loop this in. With the government medical panel that was established or constituted, was that under what legislation was that constituted?
I don't know that it was constituted under legislation. I don't know about the panel and its constitution.
Okay, so maybe Ms. DeWitt could answer that. We just want to know, how was it constituted, under what legislation or under what regulation was it set up?
Ms. DeWitt?
Certainly, I hope the committee can hear me.
Yes, thank you.
Thank you. It wasn't set up under legislation. So the panel was a review panel, and the exemption is actually granted by the doctor attending the individual, and this was a supplementary panel that reviewed materials put through from Tennis Australia.
Okay, so who's on that panel?
I don't know.
So you know how it was constituted, but not sure who's on it.
That's correct.
So who would have appointed those people? Is that the state controller?
What's got to do with the orders?
I don't know.
No relevance.
All right, thank you.
Thank you.